chance your husband or father like black pepper and garlic? They said he had it in every room of the house that there was a television. Because whenever he was watching something and he was having a snack, he was shaking black pepper and garlic on it. My wife looked at me and shook her head, because in every room of my house where there is a television, I have a container of black pepper and a container of garlic. Because anytime I'm watching television and I'm having a snack, I'm shaking black pepper and garlic on it. Now, I can't say that it is because directly, like in that movie, I'm getting some message from the tissues of my donor, but I'm not going to refute those friends of mine who are recipients who say that it is true. I'm just going to say that I don't know if it's true, all right? But I want to show you something else about the impact. Mrs. Fabiola, there you are. Yes, go ahead. You got a question first. No. Don't have the video. You are really hooked up on that. You really want to see that video, don't you? Yeah. Y'all keep your eye on this girl. Never be alone, apparently. All right. Yes, sir. You got a question. What kind of video? You know, I think that in this day and age, we are a litigious society. Y'all know what that means? There's a lot of lawsuits, okay? You probably won't be able to get video all the time of everything that was done, just in case. And then maybe that's why I can't find my friends don't have videos to show of their transplants. But I want to show you also, I talked about my heart transplant. I talked about a little about eye. If you see the world through these lenses, these are just two of the conditions that people might have that make it necessary for them to have a corneal transplant, a replacement of the cornea. Can you imagine waking up every day and seeing the world like this? This is something that a donor can help correct. Please. If you are a tissue donor, these are some of the people's conditions that could be affected. This is a baby who was born with its internal organs on the outside of its body. You saw that on Great There you go. See, what did I tell you? What did I tell you? Okay? All right. So what is done in this case is a tissue center like my own, United Tissue Resources, provides a skin graft, actually many skin grafts, because that child, you notice it's gray and the rest of the area around the stomach is pink. The veins haven't started to grow into that tissue as yet, and they will only after repeated surgeries. Years ago, this child had very little chance of a life. They were born waiting to die, essentially. Now, a donor's gift could possibly save that child's life because skin can be donated at the time of a person's death. This entire rig right here is made out of human bone. Bone is the most flexible of all the tissues as far as the way that it can be used in the body. At the top, you see an eye. Somebody obviously ran with scissors. They say, don't run with scissors, you poke yourself in the eye. All right? Damage to the eye was repaired using the pericardium, the sac around the heart. We're like Legos, folks. You can snap pieces into place, practically. We're recyclable. Please, again. Here's more bone. Everything on the left-hand side of this slide is a type of human bone. What is your name? Cameron looks like she's a troublemaker. Maybe she's out on a Friday night having a fight, okay? She is? She's what? She's a goody-goody? All right. Let's say Cameron was in a fight and got her tooth knocked out. So bad that in order to reset that tooth, they had to pour powdered bone into a section of her jaw, let it mold and harden, and then put a tooth on top. That's a dental procedure. That's not even done in a hospital. A dental surgeon, an oral surgeon can possibly use tissue. Here's another case of the spine being fixed, facial and jaw reconstruction. Up at the top is ACL surgery. You see an example of split thickness skin being spread between the fingers of a technician. Burn victims, wounded warriors, Ms. Segovia mentioned car accidents. All of that might call for tissue. All of the screws. I used to tell people, I said, imagine that this is look at the foot, can you see all 7 of the screws in that foot? And I used to ask, I hope that's a man's foot, because it would be an ugly woman's foot even in an x-ray. And then a woman in the back of the room said, how come it has to be an ugly woman's foot? How come it can't be a pretty woman's foot? And I said, okay, let me stop saying that. All right. But imagine how mangled that foot must have been to require 7 screws. In the past, you put those screws in, you got to go take them out. Now, bone can be used, formed into a screw. 100% bone, those screws. And once you put them in, you can leave them in. The body accepts those screws as their own. It requires less repeat surgery and less risk of infection.